Arbo Dental Care. I want to do a quick video to show an example of what problems a wisdom tooth can cause. And I'm showing this photo of a case that we saw recently where we took an x-ray and we saw how the wisdom tooth was literally digging into the tooth in front of it. And when we look at this image, a lot of things are happening, and normally not all of it happens at once, but in this case it did. So the first thing is that the wisdom tooth, which is on the far right of the image here, is the one that's almost horizontal. We call this mesioangular impaction, and it is digging into the second molar here. And in this photo, we're starting to see a few things and what started it all off. The first thing is that when the wisdom tooth is digging into the second molar, we get a deep cavity. So food would be chewed and would accumulate here, and along this path it starts to form a cavity on the second molar in this location. The reason is because it is not a cleanable area, so a toothbrush and floss cannot be cleaned in this area. But as the cavity got worse, over time the wisdom tooth started to move into the second molar even further because it's constantly trying to come out. As a result of this deep cavity, the nerve, which we can see the shadow in the second molar, starts to break down. And when it breaks down, the bacteria from the cavity go into the nerve and then down the length of the root and into the bone here. As a result, when the bacteria gets into the bone, we get the bone loss. So the bone loss starts to develop, which is this red dotted line here. The bone should normally be around at the level of this white dotted line here. So when we get this bone loss, we get a large shadow in between the roots of the teeth where there used to be bone. Because of the bone loss, and the patient still kept this tooth because they just withstood the pain, over time the chewing forces, the thousands of meals that we have every year, starts to accumulate and the tooth can no longer withstand it, and so it fractures. So this fracture, this faint line here, we normally can't see a fracture on an x-ray, but in this case we could because of everything that has happened. It's almost like a domino effect when you have a wisdom tooth causing a cavity on the second molar nerve that dies, the bacteria infiltrate and causes the bone loss. The bone loss then leads to the tooth not having anything to brace it or to support it, and it fractures. And so this tooth is no longer fixable. The treatment for this patient would be to remove the second molar as well as the wisdom tooth. So the moral is that if we had removed the wisdom tooth years earlier, this patient would still have a functional second molar that they could continue to chew on for thousands of more meals. So hopefully this gives some insight on what could happen if a wisdom tooth was not removed at a young age and has been kept around for decades. It ends up being 2 teeth removed instead of just the 1. Hopefully this makes a lot of sense, and if you like this video, let me know and I can make a few more of the cases that we see every day. Thank you.